how much money will be there for me?
If you pay in enough years, and if you need CARES, 3 activities of daily living, then you might qualify.
Well, don't tell me. Just let me add it all up. It's like $60,000 a year if I go to some fancy, $100,000. I would say the state of Washington will provide for me like $30,000 a year.
$36,500
for a year.
Not a year, lifetime benefit of $36,500. So in some cases that'll be 3 months of nursing home care. In some cases that will pay for some home care. But the main problem with this is that you're telling workers what they need to save for when it's a need they might or might not have, and they have other needs that they need to be spending money on.
Yeah, but Elizabeth New from Washington Policy Center, you guys went through all this in 2019. Let's Go Washington tried to stop it. I don't know if they got an initiative out there. I think they did, because they said the numbers don't work. You're going to have to continue to tax more and more and more. Right now, 50 cents on the 100, but they're going to have to keep going up. Poor people are going to end up subsidizing rich people. All this stuff was pointed out, but it didn't matter because they did it anyway, and now it's going into effect, and you can start signing up. I guess that's the good news?
Kinda. There's some good news there. The part that I'm concerned with is they told the public that if you're caring for your dad, you can get paid for caring for your dad in his elderly state, and you don't have to join a union. But right now, it looks like they're guiding you to become a union member of SEIW or SEIU. And then some of that money, that WellCares money that's already inadequate to pay for long-term care, will be going toward a union.
Right. So the reason they have the union thing in there is because since the money is coming from the state, therefore the state puts certain requirements as to how they're going to pay you and then the type of care you're going to be providing, right? So they want to make sure you're meeting the great standards of the state of Washington, and you have an opt-out. I went online because I follow the thing you put at Washington Policy Center. I was so confused. I thought, well, I'll just call you and ask you how to follow through. But it looks like they kind of want you just to sign up and be a part of the union.
Yes, and that's the hard part I'm having with it. I've talked to them in every webinar they host to tell providers how to enroll with WellCare so they can provide care to family members or to other people. And they say that there's another pathway that we're going to have for people who are just caring for family members so they don't have to join a union and give some of their money to unions. We're going to have that pathway, but they have not had it yet. They do not have it online. They do not talk about it in the webinar. So if you're going to sign up to be a caregiver for a family member who is a WellCares beneficiary, you might be expedient and just click the links provided, which take you to Consumer Direct Care of Washington, which is a union, which is connected to SEIU, and will have you paying union dues and being a member.
Right. So the opponents argue that the program is not primarily designed to help all Washingtonians, but rather to benefit the union like SEIU 775, which advocates for more taxpayer-funded caregiving. There's also no clear guidance on whether the family caregiver can opt out. Can you opt out of the union if you'd like?
Not if you join, not if you go through them. The WellCares people told me that if you sign up to be a caregiver through CD, Consumer Direct Care of Washington.
Yeah, how much have you had to drink today, Elizabeth? Boy, you're tripping all over your words. Whatever you're drinking, I'd like one.
There's too many acronyms. They're driving me crazy. But yeah, if you sign up to be a union in the way they're pointing you to,
yes,
you will be a union member paying union dues. And that's what I'm hoping that people understand. You can choose to be part of a union to give care to someone who is a WellCares beneficiary, but the law says you don't have to be. And yet there's no recipe for how to go about this without Consumer Direct Care Washington, which makes you be a union member.
Got it.
And, I do think this program was created for multiple reasons. One, to give people help with long-term care.
Fair.
Two, to help the state with its Medicaid budget. We are a graying population, and more of us are requiring long-term care and using Medicaid, even if we have means to support ourselves through long-term care.
Right.
But
let's explain for everybody. The federal government, is it a matching? Is it 50-50? Do they come in, or is it 90-10? I forget the numbers it works out. The federal government, the federal government writes a check from an account they have no money in, and then they send it to the states, and then the state says, "Hey, thanks for that money that we don't have, that you don't have, and now we're going to take part of our money and we're going to combine it together." And that's going to be Medicare, Medicaid, when it is. And then that's going to be the cash available for the state of Washington. Yes. And then we now are also going to contribute money. You say 50 cents on the $100, which, by the way, I read how the thing was written. They can keep upping that as they decide, it's insolvent. We have too many people cashing in on this, too many people using it. There's not enough money there. They could take it up to $1 for every 100. They get to get up to $5 for every $100. And then you're going to have people that make $50,000 a year contributing at the same level, right, as somebody who's making $300,000 a year.
Yeah, that's the hard part. You're giving workers' wages, including low-income workers' wages, entry-level workers' wages, to people who sometimes have zero need for any taxpayer dependency. People making loads of money.
Right.
So that's the hard part of this, is watching wages be taken from people who need them to pay for childcare, their medical bills, their groceries, their fuel that we tax at an exorbitant amount. Mm-hmm. And we're asking them to give their money over to someone who doesn't need it.
And they did the same thing with the Family Leave Act, that you could, because you did a number on that at Washington Policy Center. You dug into those numbers and you're like, oh, I see. People that are using the Family Leave Act, taking, I don't know how many months or whatever, they're making $250,000 and they're taking off, was it 12 weeks, whatever you get or something like that. But the guy that's, washing dishes or slapping up the drywall, he might have a kid, but he's not taking that time off because he's got to keep working, but he's contributing to the same pot. But the pot is being dipped into by people that don't need the help from the state.
Yeah. Paid family medical leave is a huge, bright warning that we should not be going down this road for long-term care. Even if the rate doesn't raise from 58 cents 100 for every 100,
right? We
see PFML has gone from 40 cents per $100 to now $1.13 per 100, and that's just in 5 years. They expect it to go to $1.20 for every $100 next year, 2027. And lawmakers are saying it should go up to $2 for every $100 to keep the thing solvent.
Right. It's a tax. You're coming along and providing a service. Oh, the other thing is, a lot of the people that were making $200,000 or $300,000, their employers were already offering it to them. They already had it. But the government came in and said, oh, no, we're going to, back up for all those horrible, awful employers that don't give it to them. So they whack everybody. And then they talk about affordability in the state of Washington. They're the problem. They're creating a problem. And if you're a guy, you married or not married, you don't have kids, you're contributing to this thing, you're never going to take advantage of it. But it's an additional burden on you, where the state just putting its big, lovely arms around you like a psychopathic octopi. I don't know, you guys, those words ever been used together in a sentence?
I don't think so.
And just loving the life right out of you. So not only with Washington Cares when it comes to providing care for a loved one at home, but then also that. And as you say, it just keeps going. It'll go higher and higher. Here's the other crazy thing that you pointed out from Washington Policy Center. So I pay into this program and then I leave the state. And
the good news is they have done a semi-fix for that. I think maybe we complained enough that it happened. If you move out of state and you've paid in, you can continue paying this tax in your new state for the required your working lifetime, and then you can still get the 36,500. but you on your own volition have to keep paying in to this tax in Washington that will supposedly be available to you then at the end of
Let's say, or how about this? So I got longevity medical clinic, so I live for another, 30 years or whatever. But then my little angry Greek wife, she goes on for another 50 years. These old Greek ladies just never die, right? Can she get some of that money, or is it just the husband, the wife? It's separate.
It's for whatever worker is being taxed. So no, it is not able to go to a spouse. And that was one of the things in the very beginning of WACARE's tax being taken from workers.
Yes.
There was a small window of opportunity to opt out if you had your own private long-term care insurance. And a lot of private long-term care insurance is something that has survivor benefits in some way.
Yeah.
So the market was there for this. Not many people were choosing it because it wasn't on the top of their priority list to fund their long-term care. But it kind of hurt that market. It did hurt that market and made it less appealing to people. If the government is going to allow you to rely on taxpayers for your care at whatever level, you're going to do it. That's what's happening with PFML, right? We hear stories from people who are saying some of these people are using it for vacation. The standard to prove PFML need is low. It's available. People are paying into it. They feel entitled to it.
Sure. Hey, listen, it's great benefit to everybody. Again, that's what we want the state to do. We want the state to take care of you when you decide to have a kid. We want the state to take care of you when you get too old. And I got to confess something here, Elizabeth. When they gave the window of opportunity to get your own program, I called up a friend of mine who does that, and he goes, here's what's happening, Curly. People are paying I forget it was, $900 or whatever, $300, and then canceling it. He said, so what happens is the insurance companies were writing up the policies, and people are like, whew, I avoided, what was it? It must have been Inslee. I avoided Inslee on that. I don't have to pay for that. And then they'd call up hey, listen, I know I just started that policy. Can you cancel it? And then they canceled it. So they got in the window, got in there, and then were able not to have to pay in.
Yes, that did happen.
I know a lot of people that did that. And then those insurance companies that were offering that, they stopped offering it in the state of Washington because they realized, hey, there's no business here. We can't compete against the state. And people were using this little sidestep to kind of get around it. But now those policies are not available in the state of Washington because they can't compete against the great and powerful odds of the caring folks in Olympia. So I guess there's no news other than the fact you get a chance to join the union, and then you can. No.
Here's the thing people need to know. If you're thinking about being a WACARE's caregiver, a family caregiver, just really pursue the options that you have available to you. The law says you don't have to be a member of a union to do this, so find out the ways that are available to you that you can choose from.
Okay.
So that's the point of my education. And, one of the silver linings of WACARES is I do think people are thinking more about the need to finance long-term care than they were before.
Yeah.
And I hope our policymakers get around to the real solutions that we could have for helping our Medicaid long-term care budget. And that is by reforming eligibility and estate recovery measures. And that's what we should be talking about,
right.
Not 36.5 for each person that they're going to run out of in a few months and go to Medicaid still.
But the good news is if you do join the union, you can tell Bob Ferguson what you want, and then he goes ahead and does it regardless of the Constitution.
That's true.
All right, Liz, you keep up the good work there at Washington Policy Center. And by the way, when you get old, I'll take care of you, okay?
Thank you.
That's my promise to you.
I like it.
All right, good. All right.